We're just, so we are recording the session today. I know some of you have emailed that you might not be able to come on time and maybe coming in a little bit later, but you can listen to this in about a week or two as soon as Abby can put it together, and we will post it and you guys can watch it.
Got it, because you won't get rid of that.
Okay, I still hear someone speaking and I can't figure out who that is. Could you guys please go on mute?
It looks like now I think everyone's on mute.
Okay, yes. It's hard to tell sometimes.
Just checked. Yep, I think so.
Yeah, I think it sounds okay now. So just as you know, we do the other webinars. Maddie's going to present first, and then Dr. Valero will present. We're asking that you hold your questions to the end, and we will take some time to answer the questions. Also, you can put your questions in the chat, and we will answer them. And that, you know, basically that is all of the information I think I need to share with you guys right now. And now that we are at 5:05, I'd like to present to you Maddie Simone. Maddie has been a member of the LAO, a certified lymphedema therapist, for a very long time. Maddie was one of the first people that engaged me when I first joined many times. And, you know, we've had a long-term relationship over the years. And I want to recognize Maddie, not only for being a staunch supporter of the LAO, being a member, being a regular fundraiser. She has been fundraising for us as long as I can remember. And I want to thank you for that, Maddie. And I think most of you may know that Maddie works out of the Windsor area. And pardon me, she has, I guess, been working with lymphedema patients for a very, very long time. And recently, Maddie has launched this a new business that she had talked about, and I'll let her tell you all about it. So at this point, Maddie, I'm just gonna hand it off to you because I feel like I need to go on mute.
Oh goodness, absolutely. Thank you so much. Okay. Hi, everyone. I'm going to figure out now how we did this. We're going to share screen. All right. There we go. I think we got it. All right. I get things situated here. Okay. Hello, everyone, and thank you so much for having me here today. I'm so excited to chat to you today about your Lymph Hustle. And as well, I have Dr. Valero joining me, and she's going to discuss integrative management of breast cancer-related lymphedema. So super excited for this whole session. As Dolores mentioned, we're going to keep questions to the end. And so when I'm done my presentation, I'll introduce you to Dr. Valero, and then at the very end, we'll open things up and grab your questions. So I will be talking to you today about your Lymph Hustle. So that is your self-care plan. And it's incredibly important to have a great self-care plan when it comes to managing your lymphedema. And remember that everyone's Lymph Hustle will look a little bit different to the next. And that's a great thing because, you know, our bodies are so unique, and with that, so is our lymphatic system. And so you don't want to compare yourself to what someone else is doing. It's good to share the tools that you have in your Lymph Hustle toolbox, but your Lymph Hustle will look different to everyone else's. And that's okay. So remember one thing, that you are the most perfectly you there is, and no one else can be more perfectly you than you. So once you find your Lymph Hustle, that too is perfect for you and only you. So don't worry about what others are doing. Do what works best for your body. I'm Maddie Simone, as Dolores introduced. I'm the president of Orient Health Incorporated. We are a corporation that's focused on creating all natural wellness products as well as like truly being focused on lymphatic wellness products. I am also the president of Angeloni Health, which is an online store for clients and therapists that's focused on lymphedema products. And we're just starting to introduce health and wellness products as well, but all in that self-care regimen. I'm also the founder and president of Lymphology Skincare, which is an all-natural skincare line that's focused on stimulating and supporting your lymphatic system. And I run the Lymphedema Awareness Network in LaSalle, Windsor, Essex County. And we run a monthly support group for lymphedema for those local. And I also run, as Dolores mentioned as well, the yearly fundraiser for the LAO's Compassion Fund. And I absolutely love doing that. I am a wife and a mother. I have 2 amazing children. And all the work that I do is in honor and in memory of the 2 brothers that I lost. One to a rare cancer and both with a rare aortic condition that I too have. And so everything that I do that deals with work and lymphedema and lymphatics, it all has to do with honoring them and keeping, you know, their memory alive. And so you'll see that if you check out our websites that I do mention them as truly my inspiration for much that I do. All right, so what is a lymph hustler? And if you've seen any of my talks before, if you've talked to me personally, one of the things that I always say is keep your lymph hustle strong. That's my big thing, because I am a big advocate for self-care. And when it comes to managing your lymphedema, self-care is so important. And I know if you're dealing with your therapist, your vascular surgeons, your doctors, self-care is a big part of managing your lymphedema. And it should be something that your therapists are really pushing for as well. So what's a lymph hustle? It is the effort in using various wellness practices that we're going to discuss today to direct one's self-care routine to providing support to the lymphatic system. And what's a lymph hustler? Well, it's someone that does and puts forth those efforts. And so some of the things that can be in your lymph hustle are things like dry brushing, gua sha boards, and your compression garments, rebounding. There's so many different things that we're going to talk about today. And there's other things that you can add in to your lymph hustle toolbox. We're just going to discuss some of the things that I have found in my practice in the past 10 years as a certified lymphedema therapist, the best things that worked and that I found that there was great compliance for. So in review, let's just discuss a little bit about the stages of lymphedema in case we do have some people on here that are newly diagnosed, or just, you know, just to get a brief review of. So stage 1 is when there is abnormal flow in the lymphatic system, but you don't really see any signs or symptoms. In stage 2, you start to see accumulation of fluid, so the swelling starts to happen. When at the end of your day, for example, you put your feet up, the swelling can resolve when you're elevating the limb. And when you're pressing in the area, you can still see dents in the skin, but now you start to get in this stage, pitting that can start to happen, where now you're seeing your fingerprints stay on your skin. That's just showing that because there's lack of movement, we're starting to get that lymphatic fluid starting to thicken. In stage 3, we move into more permanent swelling. And so this is the type of swelling that when you put your legs up or your arm, you elevate your limb, it's not going to fix that swelling. Pressing on the area now, you don't see as much of the denting because there's so much fluid accumulated. And then the pitting starts to happen and skin changes are happening in stage 3. You start to get the thickening, the darkening, and some of the scarring start to happen. And in stage 4, you're at the final stage of development for lymphedema and where it progresses to. And this is where you have your thickened, quite thick skin. You have growths and extensive scarring. And this is where now you're needing more attention to your lymphedema. Some of the symptoms that you can experience with lymphedema are the swelling and puffiness that we talked about, pitting and thickening tissue. So this is where that fingerprints start to show up when you push into the skin. Your edema and your swelling, blisters and weeping. So weeping can happen when there's a lot of fluid accumulation and there's nowhere for that fluid to go. Skin infections, dry and scaly skin, all of those start to happen. And of course, heaviness and fatigue in your affected area. You can also see decrease in the ability to see your veins or your muscle fibers, your muscle contractions. You can't see that as much because, again, we've got the accumulation of fluid blocking that. That fluid is also going to cause changes in your range of motion because you're starting to feel tightness now in your joints, so you don't have that full range of motion in your joints. And now you can start to see, as the picture shows, a progression and seeing a change where they're not symmetrical anymore. So in the arms, for example, you're starting to see one that is significantly larger than the other, even just a little bit larger. There's change. And then, of course, the skin infections like cellulitis can begin to reoccur. So now let's talk about the Lymph Hustle toolbox, the self-care toolbox, and what things we should have and really focus on. So when you're speaking with your therapist, when you're speaking with your vascular surgeons, your doctors, they're going to talk to you about diet. Diet is a big part of maintaining or diminishing the inflammation in your body. And it's really easy to do through foods when it comes to the foods that you're putting in your body. So your doctors will likely offer an anti-inflammatory or a keto style diet to help remove the inflammation. So essentially, you're not going to be eating those processed foods. Those you can even go through and see what foods make you personally have inflammation in the body, and you'll start to be able to identify those. Those are going to be, removed and will help you with maintaining a more comfortable feeling in your body with inflammation. My favorite tool for this is what I'm sharing with you today. It's the Lymphedema Management and Nutrition Guide. This is a fantastic tool because not only does it give you nutrition information, but it also holds a great list of things you can do to manage your lymphedema by means of self-care. So all the things we talk about today, if you're wondering, how do I do these? How to specifically, Maddie talked about it, but I'd like to get a little bit more. It's all in there. It shows you how to dry brush, how to, so many different things in this book. It's a great resource to get. Another thing is rebounding. If you've had your therapist tell you about homework and rebounding is part of it, that's what rebounding is. And the top picture here is a trampoline essentially for one. And what you want to do with your trampoline is gentle bouncing. So we're not interested at this point in getting your heart rate up. And, we're not worried about doing a cardiovascular workout. What we want to do is stimulate lymphatic movement. And so in doing this, all you're doing is a light bounce. It's almost mimicking like you are on a boat, for example, where you're just lightly bouncing. And as you get comfortable with that, then you can add in arm circles and movement in the arms to get movement with the upper body as well. As a therapist, I'm always suggesting the rebounders that have the handles, because a lot of times when there's imbalance in limbs, we don't want to throw your full balance off and have you have an opportunity for injury. And so this way, when you're stable on and you're bouncing on the rebounder, then you're still safe and we're not worried about injury at that point. And so you can do this. It depends. You can do it from 15 minutes to 30 minutes a day or every other day. But the thing to remind yourself with all of these things is work at your own pace. I had a client that could only do 30 seconds. That's it. She would get on the rebounder and for 30 seconds, she would do her bouncing and then she'd have to get off and rest. And now she's doing 10 minutes. It took her a long time, but she did it. And that's why I say never compare your Lymph Hustle to someone else's, because just because I can get on there and do 10 minutes doesn't mean that you should be able to do that. Work at your own pace and get your lymphatic system strong at its own pace. And so again, not worried about working out or getting that heart rate up. This will feel like you're doing a workout because it does get your muscles working, but you're really just wanting to mimic that bounce, that being on a boat where it's going to stimulate the lymphatic system and push it up. The other thing that's really great to do is pool or outdoor walking. So let's separate them a bit. So with pool walking, the great thing about that is literally just being in the water. The pressure of the water is going to stimulate your lymphatic system. Any sort of movement in the water will offer that pressure against your lymphatic system. So knowing how the lymph system works, it's a little bit different than your blood system. Your blood vessels have the little shelves that, you know, when they contract, they open, allow the blood through and then close back up, and it doesn't allow the blood to fall. With your lymph system, we don't have those little shelves. So your lymphatic system is dependent on muscular contraction to get that fluid up and moving. And so when you're in the pressures of the water, it's going to push that fluid up and keep that circulation moving within the lymphatic system. So really good to do. And again, we're not worried about heart rate, literally just walking. If you want to move your arms as well, as long as they're in the water, that's all that's going to take is to get to, and it will get your lymphatic system moving. So that's all you need. And outdoor, we'll talk about compression on the upcoming slides, but outdoor walking is really good because lymphedema, again, needs that muscular contraction. And so when you're wearing your compression garments, we'll talk about that in a minute, it will offer extra support in pushing that fluid up. So moving rather than not is the best thing to do. So again, not worried about going for a jog or running a marathon, anything like that. Literally just walking outside is all you need to do. And you'll get stimulation to your lymphatic system. All right. Some of my favorite tools that I like to suggest to clients with lymphedema are dry brushing and gua sha. And so dry brushing and gua sha do very similar things with increasing your lymphatic stimulation, as well as gua sha will also stimulate your blood system as well, so your blood circulation. And so with a dry brush, you want to use that on dry skin, and you want light strokes towards the heart always. And what I do that's a little bit different, I think, than if you were to, for example, Google or YouTube a video on dry brushing, you know, they're always saying start at the fingers, start at the toes, and work up towards your heart. What I like to suggest for my clients is that you're stimulating the pathway before you send fluid. So all of us that are in the lymphedema world, we have issue with a damaged area or a not functioning fully area of our lymphatic system. So we want to make sure that we stimulate that area before we're sending fluids to it. So I always tell people to start with the neck, always towards your heart, but starting at the neck and stimulating down depending on what you're doing. So if you're working on your arm, for example, you're stimulating your underarm first, your upper arm, your forearm, and then your hand. And that way you're not causing any sort of a backup. But with your dry brushing, you want to be very light, almost like a tickle, a little bit of movement in the skin, but if you're getting any redness, now you're exfoliating, you're going a little bit too deep at that point. But just that little bit of a tickle, that little bit of movement in your skin, and you're going to have stimulation to the lymphatic system. And gua sha offers the same thing, but just a few different rules to that one. If you're going directly on the skin, you want to use an essential oil of some sort to have it glide on your skin. The wonderful thing about gua sha is that if you have an area of thickening tissue that starts to pit, you can go a little bit harder with pressure with your gua sha, and it now in smaller intervals. So you want to go at little sections, maybe 2-inch sections, and push that fluid a little bit harder down towards your heart in little sections, moving up, starting closest to your heart, and then moving down to move that fluid and liquefy that fluid. And that will start to get that pitting to liquefy a little bit. And then at the very end, you can go lighter and stimulate and move that fluid out. So whatever you were able to liquefy, now your lymphatic system can move that out. And so compression is going to be a big part of, probably already a big part of your world. When you have lymphatic treatments done, so your manual lymph drainage, your therapist is either going to bandage you or have you put your compression garments or put your compressions on for you directly after. And the reason is because your lymphatic system needs that support. to be able to continue to move that fluid, up your limb and drain it out. So what I wanted to explain when it comes to your compression is there's different levels of compression, and there's also compression for daytime and compression for nighttime. So it's important to work with your therapist and your fitter to make sure that you're getting the right compression. And how it works, the science behind your compression garments is that, again, when we look at the skin, and this is your muscle. So your muscle contracts in and your skin allows it to move. And when you have a garment that you place on over top and you have that same contraction, now your skin doesn't have that flexibility anymore. And what happens to the force of that muscle contraction? It's pushing back even stronger into the body against your lymphatic system. And so that's going to push up. So you don't wear your daytime garments because that compression level will be a tourniquet without muscular contraction. So you want to make sure that you're wearing the correct garments at the correct time of day. And the last thing here, lymph pump. If you can get a lymphatic pump either access to at a clinic or have one at home, they are absolutely wonderful. You can do up to 2 hours a day on your lymph pump with 1 hour intervals. So typically it's done 1 hour in the morning and 1 hour at night. You'll see a great decrease in limb size and heaviness in the area. So all of these things you can do. A compression, of course, you're doing daily. Your lymphatic pump you can do daily. Your gua shin, your dry brushing can be 10 to 15 minutes per day or every other day. To give yourself a break with your lymph hustle, but you can do all these things every single day to support your lymphatic system. So now let's talk skincare. This is a really great aspect of what should be in your toolbox for self-care for your lymph hustle. So what happens when you have lymphedema? What happens to your skin? It stretches and thickens due to the excessive fluid that's being trapped. And it progresses to excessively dry and scaly skin. You start to get blisters, skin infections start to reoccur because of the lack of movement. A couple of things that are important to note about your lymphedema skin is that pH level is important. Skin's natural pH level is weakly acidic. So the ideal products to use on your skin should have similar pH levels to maintain balance and skin health. Weeping and blisters occur because the channels are blocked. So there's nowhere for that fluid to move. So the skin gets swollen, it gets tightened, and really the only option for that fluid is to push and leak through your skin. And so with that second part there, compression is absolutely necessary to stop that weeping. So lymphology skincare, our pH level is 5.5. So if you see in our little skincare, our skin pH scale, that's weakly acidic. So it's perfect. It falls right in line with maintaining your pH level. We use all natural ingredients, and we are ideal for acute injuries such as scratches and sunburns. We are a vasodilator for the micro level of your lymphatic system. So let me tell you a little bit about what that means. So a vasodilator means it's something that's opening up. So it's going to open up your lymphatic vessels, but at the same time, it's vasoconstricting, so closing your venous system. And what does that mean? Essentially, your venous system, when it starts to constrict or close, it pushes out all the waste that it's carrying into it's called your interstitial space, the open space of your cells in your body. And your lymphatic system's job, all the components of your lymphatic system are to grab all of that waste, extra fluid, all the things that are sitting in that open space, that interstitial space, and it flushes it all away. So our lotion uses ingredients that are specifically designed to open up your lymphatic system and close up your venous system, allowing for that waste and extra fluid to be removed. We offer, with our ingredients, anti-inflammatory, antifungal, and antibacterial properties. We are rejuvenating to the skin because it's highly hydrating and nourishing to the skin. When we were developing this product, we took everything that happens to those with lymphedema, what happens to their skin, and we tried to get products or ingredients in there to help combat all of these things. And so it protects the skin against external aggression. So it's going to create a barrier on your skin to help prevent those skin infections. And because it's highly hydrating, discomfort is relieved because it's promoting elasticity. It's leaving your skin very supple. It's highly, highly absorbing so that right after you put it on, you can get your compression garments on. And it's a great addition to improving your circulation and your edema as well, wearing your compression garments. And as we discussed, it's pH balancing to the skin. All right, so all of these, or most of these products that we talked about today are available on angelinihealth.com. And if you want any more information about lymphology skincare, you can go to our website. We list every single ingredient, its purpose, and why we've used it, lymphologyskincare.com. And so how do you connect with us? There's a few different ways. We are on, or I am on Instagram and Facebook with both Angeloni Health and Lymphology Skincare. You can connect with me on my business page on Instagram at Maddie Lymph Therapist. And you can also join me on Facebook for the Lymphedema Awareness Network of LaSalle, Windsor, Essex County. So don't worry if you don't have Instagram or you don't have Facebook, because Maddie Lymph Therapist and the LAN group, LaSalle, Windsor, Essex, are connected. So what I post on Maddie Lymph Therapist will also post on the Lymphedema Awareness Network. And so all of our dates for support group and events that we're doing, the fundraisers and links like that are all on the LAN LaSalle, Windsor, Essex group as well. So, and I think we mentioned we're going to do questions at the very end. So I'm going to just transition into our next part. So I now have the pleasure of introducing my very good friend and colleague, Dr. Megan Valero. She is the founder, CEO, and clinical director of Valero Wellness in Windsor, Ontario, where I work as a certified lymphedema therapist. She is also the founder and CEO of the V Apothecary. It's a dispensary and supplementary store that's located right beside and attached to Valero Wellness. Dr. Valero is a naturopathic doctor who specializes in naturopathic oncology. Oh, okay. I don't know what happened there. That was awesome.
That was me, sorry.
No worries. She is a fellow of the American Board of Naturopathic Oncology, and her practice focuses on integrative cancer care, survivorship, and cancer prevention. She authored several research publications in peer-reviewed journals and worked in cancer research for 5 years before becoming a naturopathic doctor, and recently did a TEDx talk on naturopathic oncology. Today, she will be discussing integrative management of breast cancer-related lymphedema. I present to you all Dr. Megan Valero.
Oh, thank you, Maddie. That was super nice. I'm so happy to be here. It's really great to speak about this because it's my ultra passion is anything related to cancer, and especially with lymphedema. I personally find in my practice that, I don't know if this is people's experiences. I'm not sure, our group, I think, comprises of a lot of people who are dealing with lymphedema themselves, but maybe you have a few practitioners here. But I do notice that when someone's been diagnosed with breast cancer and there's a real risk of lymphedema happening, it's actually 1 in 5 women are going to develop lymphedema after having cancer treatment. So especially if lymph nodes are removed. And the amount of education that happens around that in cancer clinics is often lacking. I'm always surprised at how much patients don't know in terms of just basic things that they should be doing. And organizations like this are so crucial because a lot of that education comes from you guys, from the LAO, and from everything that you're doing. So it's really nice to be here and just kind of shed a light on this topic a bit more. So today I'll be talking about integrative management of breast cancer related lymphedema. And just some notes that Maddie had spoken about. I'm not sure how many people know what a naturopathic doctor is, but we are basically trained like physicians. But in addition to knowing everything there is to know about pharmaceuticals and physical exams and blood work and whatnot, we have to also learn all the evidence-based natural tools for treatments and remedies that are out there. So we are trained in acupuncture, herbal medicine, nutrition, diet, supplements, hydrotherapy. We even do a version of chiropractic, and we even learn massage. Like it's a very comprehensive program. And then on top of that, I have done extra education and designations in oncology. And so technically my specialty is naturopathic oncology. And I've just recently become a fellow of the American Board of Naturopathic Oncology, which is kind of a huge deal because there's only, well, I'm the only one from here until I want to say Guelph is the next closest area. We're a very small group in Canada and especially in Ontario. So it's very nice to have that. And basically the practice is very integrative. So what my whole point of my practice is to help to merge the conventional therapies that people will do in treating cancer and merge that with anything in nature that will be shown to be safe and effective and supportive alongside conventional care. So it's a lot of integrative medicine. I am also the CEO, the founder and clinical director of Valero Wellness. It's the clinic that Maddie and I both work at. And I am the owner, founder, CEO, all of the things at Via Apothecary, which is our dispensary just beside the clinic. And I did work in cancer research for many years. I studied apoptosis, which is a fancy term for programmed cell death. It's how cancer cells are supposed to kill themselves, actually. We do it all the time. And if we are unable to do that, then that's how tumors develop. So I spent quite a bit of time studying how plants and natural treatments can induce apoptosis in cancer cells. And yeah, and I did have the pleasure of doing the TED Talk not that long ago. And that talk is a great summary of why I got into this field. I personally lost my mom and my father to cancer, actually. And for my mom's experience, I was quite young when she had it. And so that was a big motivator, and just learning everything that there is that we can do that might be a little more outside the box of the conventional kind of cancer world, and just how do we integrate the two so people feel the most supported, because that is really where miracles lie. And I feel like there's just so much more we can do when we all work together. So that's a little bit about me. In terms of naturopathic oncology, I think we touched on this a little bit. That's a little picture of me at the TED Talk. And there's a picture of Brittany. She's one of our IV techs at the clinic, and we do intravenous therapies for cancer therapy, and pretty much have it all. It's a one-stop shop for everything cancer. We do really, as I mentioned, we're kind of integrating care to give people their best outcomes, but a lot of that boils down to just helping improve quality of life, helping manage side effects. I don't know how many times I've had patients come in ready to quit chemo because they couldn't handle it anymore. And just with some simple integrative therapies, we can turn things around to the point where they are handling their treatments perfectly fine and are having better success with it. There are many things in our toolbox that can actually work well with chemo and don't interact in a negative way that can actually help improve outcomes and the chance for remission. So that's kind of the meat of what I do here. And even just preventing recurrence, there's a lot of simple things that are useful for that. So I'm going to skip through to the meat of the talk here. So basically, I was just wanted to cover a couple key areas in terms of integrative management of breast cancer related lymphedema, similar types of kind of things you do, whether it's breast cancer related or not, but just some things that were a lot of studies that were really key in more recent studies too, and showing the benefit of a lot of these modalities and how they can be integrated. Kind of like Maddie said, like it really, you are your own person. So at the end of the day, you can't really follow just a strict algorithm of how to manage all of these different things. You really have to see what works best for you, because some people rebounding will be the the ticket to controlling it. And some people will need a lot more therapies to help them out. And so it's really just about exploring all those options. And today is just highlight a lot of the research behind them, so you know that they're legitimate things that are definitely backed by studies and really good quality research too. So I'll skip over here. So the first one is just simply avoiding trauma and injury. Once we've had lymph nodes removed, especially if it was for cancer reasons, or even if we didn't, and it's just, we just have a sluggish lymphatic system and tend to develop some variety of lymphedema, our lymphatics are just very delicate. And so in order to prevent that from worsening, we have to protect it at all costs. And it takes a bit of extra work once it's happened for cancer reasons, or lymph nodes have been completely removed or completely damaged through radiation. So something as simple as just maybe even wearing a lymphedema alert bracelet, because how many times if you need to go for blood work and they're going to take blood out of your arm, there isn't necessarily a thought of, oh, it can't be that one arm. And if you forget to mention something, it could happen, they could take it anyway. And the blood, having that blood removed in that sense could kind of put you at risk of developing infections, of having trauma to that area that you can't afford. So it's just a simple thing that you can do, especially for medical appointments. You just don't want to have that conversation. That's the first little cue for any tech to know, oh, okay, I better not touch this arm. And the next point, just saying never allowing venipuncture. So just getting blood drawn or having IVs in an affected limb. It's kind of a controversial. I feel like they've gone back and forth of, do we need to avoid it? Do we not need to avoid it? I think just erring on the side of caution and avoiding that is always better than just taking the risk. There's some people where there's just no veins on the other extremity. So you kind of, sometimes you might have to go there, but always better not to, and just find another option in terms of a vein. Simple things like wearing gloves when you're gardening, when you're washing dishes, doing housework, anything where you could potentially could lead to a cut. Even if it's not at the site where the lymph nodes are removed, if it's even on your hand, that could lead to a strain on the lymphatics that could lead to a worsening of the edema. So we have to be really careful there. Protecting your arm from burns and from the sun is so huge. I mean, that people don't really, I think, appreciate how just the damage to the skin, like our lymphatics, like Maddie was saying, dry skin brushing, it's not something that you do aggressively. It's something that is very gentle, and it doesn't have to be aggressive, because if it is, you just skipped through all the lymphatics and went straight into muscle tissue, and now we're not even treating that anymore. And so even just the sun burning your skin can damage the lymphatics and make it more susceptible to swelling. So definitely putting lots of sunscreen, keeping everything really hydrated is key. And then avoiding extreme temperature changes. I mean, I recently got married in Mexico, and I can say for certain that that impacts your ability to swell or not. As if it's too hot, people do tend to swell more. And so avoiding saunas, even just being careful with hot tubs, those are things that we really have to think about if we've had any lymph nodes removed. Very important. Even just cutting cuticles of your nail beds instead of cutting them, just pushing them is something that we would want to consider doing. Even just shaving, especially in that limb, using an electric razor as opposed to actually shaving, just eliminates the potential for more swelling down the road. And then avoiding repetitive movements is a key one. Depending on the type of movement, it can lead to more irritation. Avoiding carrying very heavy bags. If you don't need to, just don't, because it's not worth the potential of setting that off. I even had that with my now husband. He had a life-altering accident at work once, and so he has a bit of lymphedema in one of his arms because he almost lost his hand. And when we were dating, I think he tried to impress me by showing me how many push-ups he could do, and just the repetitive motion of that and the strain with the weight on his wrists, which he couldn't handle, caused everything to swell up, and it flared up for quite a while. It took a lot of work to get that to go back to normal. So even just simple repetitive movements you don't think could cause harm might. So it's all these things that have to be kind of taken into consideration. You don't want to carry heavy bags, like we said, and you definitely want to wear a well-fitted bra that doesn't have underwire, preferably, just because if it's too tight and you can see those marks, it's already been squishing all the lymphatic tissue. And especially if that's happening in the chest, all those lymph nodes in that area will feed lymph node areas that are damaged in an extremity. And so that can just create a bigger issue over time. So that's really important to do. And then just as simple, if anyone sews, wear a thimble, because any little potential pokes you could do with a needle could definitely kind of create an issue down the road. So all simple things to just keep in mind. Then the next part is just avoiding any constriction of the arm or changes in atmospheric pressure. So blood pressure measurements are another thing we have to avoid on that arm. We don't want to wear tight jewelry or tight garments that could kind of block the circulation. So no super tight Kim Kardashian clothes, ideally. And then when you're traveling, just definitely wear a compression sleeve. I don't think you could go without it at this point. It's one of the most kind of proven and shown ways that you can help control the edema from getting worse. So increasing your fluid intake is really key, especially when traveling. Just all the different pressure changes definitely have a massive impact. So those are some pretty important key points. Diet and weight management. So this is really important, not just for lymphedema, but just for cancer management in general. There's just so much data showing that keeping a stable weight in general, like instead of yo-yoing back and forth, that change is really stressful to the lymphatics. But just the biochemistry that occurs with fluctuating weight like that is really stressful to a system that's had cancer and can actually increase the chance of recurrences. So for so many different reasons, it's really key to try to work hard to maintain a stable weight, in terms of like the perfect weight. I mean, that's another story, but just a stability is really important too. And keeping, a weight that's healthy for you is really key. Keeping a healthy diet, like a, well-balanced, low sodium, low fat, high fiber. And then recent studies are kind of looking at low carb, as Maddie mentioned, almost like a keto type style diet does actually make a big difference in how lymphedema can manifest or not. So that's really good to keep in mind. The diet should definitely contain protein that's easily digested. So like chicken, fish, and I put tofu because soy is a food that a lot of people are terrified to eat. It's just had a bad reputation for a long time. I've assumed that as a natural phytoestrogen, as in nature, that must be bad for people with breast cancer, but it has been definitively proven for over a decade that it's actually really helpful for people who have breast cancer, people who maybe are at risk too. Many women have just completely stayed away from soy, when in fact it can actually prevent breast cancer from happening, and it can prevent recurrences if we keep a healthy amount of it in our diets. It's part of the main reasons why in cultures, we just don't see as much breast cancer in Asian countries as we do in North America, where we don't really have diets that are heavily focused on soy. So that's a big one I just thought I'd mention, because a lot of people still don't know that it's actually safe to have soy and is definitely recommended. Now, the big one is smoking and alcohol. So that is a big one. It definitely impacts lymphedema in a big way. But alcohol especially, I had to just say this because a lot of people don't know this. Even oncologists have been kind of giving wrong information for a long time. They're starting to come around, what I've noticed anyway, but there really is no safe level of alcohol consumption for cancer risk. It's an issue no matter what kind of cancer we're talking about, but especially with breast. Even one drink a day, and it doesn't matter if it's wine or any type of alcohol, it will increase your breast cancer risk by 7 to 10%. Just by having even a glass of wine with dinner every day. Like, it's actually not a good idea. And I mean, I don't know, my father came from Spain, so the idea of having wine with dinner is kind of like, that's almost like a healthy thing we think of growing up. It's part of the culture, but it's actually not beneficial at all, and better to stay away from, especially if there's been a diagnosis. It's better to just cut it out, or just, have a glass here and there for celebration or an occasion, but definitely shouldn't be part of like a regular consumption with meals. 2 drinks per day. So just increasing from 1 to 2 increases the chance of getting breast cancer to 25 to 31% just by having 1 additional glass. That's the big difference in percentage risk there. And then 3.5 drinks a day can double or even triple the risk of getting cancer just across the board. So it's actually a really big deal. And I think it's just important to say, because we kind of have this sort of like Instagram wine culture of like, it's wine o'clock, I'm going to have my, my Merlot with my girls and just hang out. And really, we probably shouldn't encourage that as a society, because the risk for breast cancer when we engage in that is in that kind of lifestyle is just, it's really high, and we should all kind of be aware of that. So I thought I'd put that in the talk here. And then let's see here. Okay, so in exercise, definitely want to wear a well-fitted compression sleeve when you're exercising. Just all the changes in temperature, you're sweating, you're moving a lot, there's a lot going on. So just to keep things under control, to keep that compression there is really key. And then when it comes to actually exercising, it's a tough area to know, like, are you doing the right thing? Are you doing too much? So it is good to have like a medical professional involved in helping you guide you through that, especially after surgery, or if lymph nodes have been like if the area has been radiated. It's good to have someone professional to speak to you about that. I refer to a physiotherapist in Windsor that deals with, he's a physiotherapist that specializes in cancer, and he's the only one that I know of that does that, and does a really good job. So I refer a lot of people to him to help just guide people through that, because you can be very lost in terms of, can I do this? Is this too much? I don't know where to begin. But in terms of just general starting points, if you're working with dumbbells, just always start low, just 1 to 3 pounds. Just simple exercises are better to start with first, and kind of move your way up from there. Exercises, if they're done with machines, always start with the lightest possible weight and kind of work your way up. Same type of kind of thought there. And you definitely want to tell any health professional if you're noticing more swelling or pain or discomfort in the arm. If that starts happening with the workouts, you got to really engage your team here. Like, there's definitely lots of people we can get involved. It's so great having Maddie at the clinic at Valero Wellness, because if there's ever concerns, I can just send them to Maddie, and then she will assess that even better and kind of get more hands-on with what's going on there. Lightweight lifting with the affected arm is beneficial in the conditioning of the arm, like just keeping it healthy, but probably not lifting more than 10 pounds, especially when we're kind of post-surgery, is really key to keep in mind. And it's definitely good to do like light weightlifting, walking, swimming, light aerobics. The rebounding that Maddie talked about is one of the best things for a nice, simple kind of workout, but lots of cardio, but amazing for the lymphatics. Bike riding, yoga, Pilates, these are things that would be amazing to do. And in terms of kind of breast cancer recurrence and the need to engage in exercise, this is really like all we're talking about. You don't have to, buy a Peloton necessarily, although it's a nice way to do it. You don't really have to go to the gym. Like, just these simple things, if you can do at home, they count. And about 30 minutes a day is what's consistent in all the literature. As long as it's 30 consecutive minutes and it's every day, then you're doing a great job. That's kind of the bare minimum we should strive for. So that's a note on exercise. And in terms of surgical prevention, so I thought I'd just kind of mention this because this is interesting. There's a term called axillary reverse mapping. And if anyone's had this done, it's the technique they use when they add the blue dye and they inject it into the upper arm during surgery. And it lets the surgeon see and visually where the lymphatics are going, what they're feeding into in terms of lymph nodes. And they'll do this either when they're doing like a sentinel node biopsy, or they're actually removing the actual lymph nodes. And the act of doing this helps them to not have to remove so many nodes. And so otherwise, if they didn't, it actually just reduces the risk of getting lymphedema that normally would be a 30% chance. It reduces it all the way to 5% just from having this mapping done. So it's a good thing to do, but I've noticed in my practice, many women are hesitant or afraid to, or kind of want to forego if they can. Like there's this thought process they have of that because they're worried about the dye. And so it's kind of an interesting thing in Ontario, as I find with our OHIP system, we don't always have a choice necessarily with some of these things, but if you are someone who's concerned about that, the methylene blue is typically what they would use for the dye. It's the most standard. It's the one I see the most in biopsy reports and surgery reports. And it is a little more inflammatory. So if you have a surgeon that's willing, you could ask them to use a radioisotope or an isosulfan blue, and those are not as inflammatory. So at the end of the day, I would not do this just because the methylene blue is inflammatory. It's just not worth it. The risk reduction when we're talking lymphedema and just the ability to know what kind of general risk we're dealing with the lymph nodes, it's just important to kind of move forward with a procedure like this. So I just thought I'd speak to that because it comes up as a question often in my practice. And then manual lymphatic drainage. So this is the lovely Maddie doing her thing at the clinic. And I thought I would just include a Cochrane systematic review. And for those who maybe have no idea or not really, big on nerd studies and research and all of that, Cochrane systematic reviews are kind of at the top of the totem pole along with meta-analyses. Those are the two types of studies that if they have an opinion on something at the end of the day, whatever they're concluding, you can pretty much have a lot of confidence that it's accurate. Their statements, like whatever they found in those studies are fairly accurate. Sometimes there's some issues with them, but overall, the reason it's so accurate is because they're a review of many other studies. And those studies are also, should have a degree of confidence with them too. So it's pretty high quality research, and looking at the evidence around manual lymphatic drainage, they found across the board in 6 studies of women who had breast cancer related lymphedema that MLD was actually really well tolerated and safe in all of the women in all of the studies that underwent it. So it's actually a really great therapy and option to use. Super effective in my experience. Just seeing what Maddie, some of her before and after pictures I've seen are just wild. It's just the amount of swelling that can be reduced in one session. So I'm a huge fan of MLD. And they did find in the study that it reduced swelling in conjunction with compression bandaging. Always a great combo, probably my 2 favorite options in terms of things you can do to manage. And especially they found that was especially true in people who had mild to moderate. Once it's more severe, that's just a more difficult to treat situation across the board. So it complicates the data a little bit. But if it's mild to moderate, MLD and compression bandaging is definitely the way to go. Definitely routes you want to try. They did find some mixed results when it came to trying to evaluate, does MLD help with range of motion issues? But that's such a complicated thing. Like I feel like that's where we have to kind of interpret studies with a grain of salt sometimes, because range of motion, I mean, if we're a woman who had breast cancer and had all her lymph nodes removed, the tightness that occurs afterwards, you can't really MLD your way out of that. Sometimes you're going to need some physio, some stretching, some time. Like it's a very complicated situation. So it would be mixed results in terms of that. I don't think we should rely on only MLD to kind of help fix those issues. And then in terms of the next point, the intervention with manual lymph drainage within the first 2 to 3 weeks after having lymph nodes removed, they actually found it's really critical after 2 to 3 weeks after. And sometimes I find there's a bit of controversy with that. A lot of people are scared to even go there or touch anything. There's just not enough confidence sometimes in a lot of clinicians. And then in the conventional world, there isn't always a lot of knowledge about what we can and can't do. So I thought that was interesting because they're actually saying it's very recommended to do manual lymph drainage pretty soon after surgery to help control the lymphedema and the potential for it. And anti-inflammatory agents is also very key. In the naturopathic world, we have so many options for this. And I had to take it out of this talk because we would be here till like 7 p.m. if I did. So maybe we could talk about that in a future talk or something, but there are many ways we can help support with anti-inflammatories. Now, compression was the next one. I included a little study here of just looking at the compression bandaging or sleeves, and that how much they're an essential component of lymphedema management. So in these studies, they were randomized controlled studies, and they found that it definitely reduced limb volume and the circumference. Typically the pressure was about 30 to 40 in terms of the compression that they got from there. And in the trial, they were looking at a couple different scenarios. They wanted to see what happened if you just did daytime compression and just use a garment alone. And then what happened if you did that plus nighttime compression, bandaging. And then what about daytime compression and nighttime compression systems? So when they looked at all of those different scenarios, they found that just adding in a nighttime compression, regardless of the way that you did it, was found to be superior than just doing standard of care for there's some sort of nerd terms here of just the confidence intervals, but overall it was definitely better across the board if you add a nighttime component. So definitely a useful thing to keep in mind. And just going to keep moving along here. We're almost done. Exercise and breast cancer related lymphedema. So we've got a couple more studies. When it comes to exercise, I guess the thing to highlight here is just that current research kind of contradicts the myth that doing what we call upper extremity loading, where we're kind of lifting too much weight, could actually make the lymphedema worse or harm the lymphatics. So usually that's why we're so cautious, like maybe don't overdo it. But it actually suggests that it's better to do some weightlifting. So don't be afraid of lifting weights. But what we don't know from these studies is how intense can we go? What frequency are we allowed to do? And does the number of lymph nodes removed affect the benefit of weightlifting? So there's kind of a lot of holes in this research, which is why I would still say when it comes to lifting weights, especially, you just want to be under the guidance of someone who can really walk you through that every step of the way. And so you don't overdo it. In terms of, I guess these little points at the bottom, I kind of just summarized them all. So I'm going to skip ahead for the sake of time. And then with weight loss and lymphedema. So there is a bit of a spiral that happens with weight. If you kind of follow the picture, just obesity in general leads to compromising the microcirculation in the lymphatics. Once you do that, you're increasing inflammation, you're increasing fibrosis in the cells, you're increasing hypoxia, there's less oxygen coming to the cells. That all compromises the lymphatics, which then creates like a stasis of the flow of lymph. And that can increase the chance of accumulating more fat tissue, adipose tissue. And that makes the lymph stasis even worse. So it's just a horrible cycle that just keeps perpetuating itself. And in the studies that they looked at 460 overweight women with a history of breast cancer that led to lymphedema. And they found that just simply losing weight helped to reduce the volume of the affected limb that they had. So smaller limb in general. It reduced the number and severity of symptoms, but it did not actually help the lymphedema as a whole. Like it wasn't enough to totally get rid of lymphedema, but it helped reduce the symptoms. And it's really important to keep that in mind because if weight does fluctuate a lot, if you're managing it well right now at the current weight, if you were to gain weight, it could mean that you need to put even more effort into just keeping that regulated. So it's really important to keep that in mind. Acupuncture, they did a systematic review that proved that acupuncture is safe and it may improve symptoms of lymphedema. It just didn't consistently reduce the severity when we're talking about like arm circumferences. So it can be a useful tool, but I would say in the hierarchy of things we could try, compression, MLD, those are things that came much stronger in terms of their results. But acupuncture is really useful for many people too. So it's one of those things you just have to try and see what works best for you. And then one of my favorites, and this is, I think, the last slide, so we're doing pretty good for time, is low level laser. The cold lasers are the ones we're kind of talking about here, and they are between 50 and 500 megawatts, and they work by non-thermal mechanisms. So they're basically delivering energy through to the tissues, which is crazy because just by doing that, you can stimulate ATP, which is the kind of gasoline energy that we have in our cells. And by doing that, we actually promote collagen production. We stimulate what we call inflammatory cytokines, and we can inhibit bacterial growth. We can get the vasodilation happening in that circulation. There's just so much cellular activity going on that can wake up the tissues. And that's so crucial because the lymphatic tissue is so thin. I think it was like a micron thin of the wall around a lymphatic cell. And so no wonder it just doesn't take much to damage it or to set it off or let it accumulate. So something like a low level laser can actually help repair some of that damage and encourage things to get healthier in terms of the tissue. So in one of the systematic reviews that they did, they looked at 9 different trials of women with breast cancer related lymphedema, and the cold laser was found to reduce the lymph volume. There was definitely some reduced pain, which is really key because that is a big issue, and not every trial will see the pain piece included, and there were no adverse side effects. So all of these kind of methods are just really safe, really harmless. And just like I said, you have to kind of just find a happy medium and be willing to try a couple avenues to get yourself the best results. And that, I think, concludes everything. I just put a couple links to the clinic. We're at Valero Wellness. We have the apothecary as well, and I have a couple different Instagram handles if you want to reach out or have any questions or anything after this talk. Yeah. Let's see if there's any maybe questions.
Perfect. Yeah, I think is it okay, Dolores, that we move open it up for
Absolutely.
questions?
Yes, absolutely. I don't see anything in the chat right now, but if everybody would like to, anyone wants to take yourself off mute and ask a question, please go ahead.
I have a question, Dolores. I can't find a button on my phone to put my hand up.
That's okay.
Actually,
Go ahead.
I have 3 questions. So do I get to ask all 3 at once, or is it one at a time?
Well, I don't see any other hands up, so go ahead, Ina.
Okay. So as far as diet, so Maddie mentioned anti-inflammatory diet, which could be a keto style type of a diet approach. And then doctor, sorry, I'm bad with names. I forgot the name.
Oh, that's okay, Dr. Valero.
Okay, Dr. Valero, yes. And then you mentioned a low-fat diet. So which one is it?
Yeah, well, when you say low fat, I think we're just it was very general in terms of the data. So they're kind of leaning towards just like low processed fats and low kind of just the garbage junk food. They're probably not, that's a little separate from where the research has gone to in terms of ketogenic diets. Like if you're going full ketogenic, you're having a pretty high fat diet, like if you're actually doing it full on. So that's not really what they would refer to, like that when you do a high fat ketogenic approach, they only see benefits with the lymphedema. So it's a little bit different. It's more just if you're not in a ketogenic mode, like that's a whole different metabolic adjustment that you're doing to your body. So if you're not in ketosis and you're having a lot of fats, but you're not cutting out the carbs and you're not in that metabolic mode, that high fat environment is seeming to make it worse. So it's kind of the context of higher fats with ketosis versus high fats without it seems to be a differentiating piece that helps.
Yeah, and remembering that when you're in ketosis, your body is using that as fuel, using that fat as fuel, versus when you are not in ketosis and you're using the carbohydrates as your fuel. So it's again picking one, not doing all. So if you're going to stay with anti-inflammatory, then you're looking at the lower fats, lower carbohydrates. But when you're in and you're choosing a keto diet, then you're doing more of the high fats because that's what ketosis needs.
Sorry, you just said if you're staying anti-inflammatory, you're going with lower carbs, lower fat.
Yes, like lower.
So
you're not going to have the processed foods. I'm sorry.
What do you have left then? If you have lower carbs, lower fat, you're stuck with protein.
Proteins, vegetables, your fruits. Like it's not. You're not going low in it's all the processed, I guess. That's the inflammatory side of things, are the processed foods. And then you can also look at some, because some people will have different foods that will offer inflammation to their bodies, but it's not under an anti-inflammatory food. But it doesn't necessarily mean that it's that restrictive. There's lots of foods that fall within healthy range that are not inflammatory.
Right. I mean, that was kind of contradicting, you know, the low fat, but keto. But so just as a side note, you know, when like we've been, you know, we've been experiencing the travesty of low fat approach that kind of invaded North America since the 80s. So, and everyone has been afraid of fat. So, you know, that skyrocketed cancer, that skyrocketed heart disease, and skyrocketed, you know, metabolic disorders like diabetes. So, you know, when you say things like low fat, I think it's quite important to emphasize, you know, low inflammatory fat, because healthy fats are actually anti-inflammatory. And, you know, there's a ton of people, like I am also a nutritionist, so I'm very familiar with these kinds of things. There's still a ton of people that are deathly afraid of fat. So they load up on carbs, and in addition to that, most of them load up on bad carbs, and then, you know, they get inflammation and everything that skyrockets from there.
Right.
So, you know, like this blanket statement of low fat can be very damaging to someone who's not well versed in this field.
Right.
So it's important to, you know, distinguish bad fats and good fats, and good fats are actually required, especially when you're trying to, you know, minimize inflammation and as a result lymphedema. So my other question is about repetitive movement. I remember, and I'm pretty sure I read it in Pathways actually a while ago, there was an article about rowing team. And it was a team full of women who are cancer survivors. Some of them have lymphedema. Some of them are obviously, you know, predisposed, but don't have symptoms yet. And they compete, like so what about that? I mean, that's as repetitive as it gets.
Well, I think it's just the context is really what we're talking, like that doing like dragon boats and rowing. We're doing that through exercise where, you know, if we're talking someone who works in a factory and they're doing the same movements for hours on end, that's kind of more what they're referring to. So it's not necessarily the repetitive motions via exercise because it's kind of a controlled environment. And it's just kind of, it's really just the point is to be aware that if you are engaging in repetitive movements, whatever that is in your life, to just be aware if it's worsening or creating more of a swelling or not, and kind of be tuned into that because there could be a risk there is really all that's referring to.
Right. Okay.
It is important, sorry, it is important to have your compression to support the limb, but with lymphedema, and I do talk about this often, and there is someone on Instagram who is actually the living and breathing example of this, Amanda Sobey, who is a physical trainer, and she has pretty significant lymphedema in her right leg. And she is the perfect example of the idea that you can train your lymphatic system and retrain your lymphatic system. So she will compete. She has her full compression to like full thigh, and she competes and wins weightlifting competitions. And that is just the example. Repetitive motion absolutely will flare your lymphedema if you're not wearing compression, if you're not doing self-care. It's just part of what happens with when the lymphatic system is damaged and there's not proper support there. But it doesn't mean that you can't retrain your system to be able to do these things. You know, someone who works on the line, as Dr. Valero mentioned, they don't have a choice. That's their livelihood. That's how they make their money. So it's really, again, individual, and your solution may be different to someone else's, but encouraging that we don't take that for granted, that now that there is an issue with the lymphatic system, there needs to be a little more attention paid to that area, and make sure that we have the things in place so that we don't flare, for example, with with Dr. Valero's husband, and having that flare, that's a perfect example of what can happen when we take for granted that we have a lymphatic issue. And so we just, it's really just highlighting the fact that we need to have those things in place and slowly work up. The same thing with rebounding, where you're 30 seconds and now she's at 10 minutes, is working your way up to allowing your body to catch up and be able to do these things like you did before your lymphedema diagnosis.
Yeah, that makes sense. Thank you for that, Maddie. My last question in regards to alcohol. I mean, just to preface that I'm not promoting the use of alcohol whatsoever. So Mediterranean diet is an anti-inflammatory diet, and it correlates with decreased risk of all diseases, pretty much all diseases across the board, including cancer. Now, when you look at nations like, the Italians and the French that start drinking wine pretty much since birth, they don't have an increased risk of cancer. Now, the continent of North America, the risk is increasing every year. So how do we reconcile that? And in Mediterranean diet, they actually consume wine pretty much on a regular basis, but they don't suffer from increased risk of cancer.
Right. Yeah, I'm pretty sure with the data where those studies had come from, where they have these new kind of stats on 1 glass versus 2 versus 3, it actually came from Europe, those studies, if I'm not mistaken. So I'm pretty sure that's actually taking that into consideration, the Mediterranean lifestyle. It's just become that much of an issue. Like, we just I don't think fully know what we thought we knew about wine before. Is we're starting to see different trends in other ways. But I mean, so much impacts that in terms of diet, like you said, like just the difference between what does the fat mean, and and it's very different context, because the idea of low fat and don't eat this and that, and then you look at the Mediterranean, how much benefit that style of diet has on health and what it does prevent. And I mean, I definitely see that in my family that's in Spain, and just living there for a while, eating that way and having things that if I ate that way here in North America, even if I tried to recreate it, it's just our quality of food is not the same. So there's just so many complicated layers to that it definitely just, when you kind of pull those aspects out, they were looking at just the wine, knowing that it's very clear that it increases the risk. Breast cancer, the risk wasn't as high as some others, like in terms of esophageal, colon, it was even greater, the risk. So I'd have to take a look at the study to see the actual detail, but that was one of the first thoughts I had too, is okay, that's why it's such a controversial thing, because people have it in their minds that, yeah, Mediterranean, my parents and their grandparents grew up having a glass of wine with dinner, and this is such a healthy thing for cardiovascular benefit. I know that has been the big part that they looked at, but in terms of cancer, it looks like it's just changing. And I always wonder about, in terms of the terrain with sugar and just the volume of glucose in the diet, which is part of why the keto approach to eating has just so many potential benefits. And a lot of people in North America just were consuming way too much sugar. There's just way too much in the diet as a whole. And so maybe it's that adding in that wine is just tipping the scales further. But I think in the study, I do remember them talking about the ethanol and the breakdown products and how that was a type of carcinogen potentially. And so the data was looking a little bit more at that, which is why I'm wondering if with the Mediterranean, that's maybe why they're not seeing the same results at that point. So yeah, it's a very heavy topic, because there's a lot to uncover with that, especially in the world of nutrition. Like it's a deep talk. Yeah,
I think it largely it makes a big difference. Besides why, I mean, first of all, the quality of the wine, if it's organic or not. But that's a minor thing. The big difference is what else are you having with that wine?
Yeah, exactly.
That's the part that's gonna move the needle big time.
Yeah.
You know, like if you're having McDonald's, but you're skipping wine because wine, you know, whatever study found,
Right. Yes.
not really, yeah.
Maybe
And
have
that's
some
the
wine.
context. Yeah. That's always the context, especially with like a naturopathic practice. The whole premise behind naturopathic medicine is that we're all individual and it's holistic care, but it's, you know, this breast cancer patient might need a very different approach and diet than that breast cancer patient. And I think that's the difference between some of these studies that can kind of just umbrella terms. That's why it said like low fat. It's just, that's just straight language from those studies. But when it comes to real practice, you really have to look at that human being and what are your habits with food? What are your trends, and how many risk factors do you have within that? And, you know, is there wiggle room for a little bit of alcohol, or really if it's someone who's eating, you know, super high, like bad fat diet, super high carbs, super processed everything, like please stay away from alcohol, because that's just going to make it worse for sure. Where, you know, someone who's completely vegan and has tons of healthy avocados and omega-3s, you know, that's a whole different terrain and kind of microenvironment anyway. So yeah, it's a pretty heavy topic for sure.
Yeah.
Wonderful.
Well,
Those
thank
are
you very
great
much for your
topics.
input.
Thank you. Thank you. We have a comment from
Actually,
Susan.
Maddie, sorry, there was Nadine had her hand up
Oh.
for a while, but I'm not sure if she might have left by now.
Okay.
Yes, go ahead with the other questions. I think Nadine might have had to leave.
Okay. Susan just had a really great point that when people are doing the dragon boat races, a lot of the ones that are actually doing the race don't have lymphedema, but the important thing is to note that they can work their way to that point and be able to be the rowing folks in the dragon boat races. And Dr. Valero, there's a question for you from Catherine, just a few points up on the chat. Can you see it?
Yeah.
Perfect.
She was just asking if I'd seen, if I've ever dealt with people who have lymphedema in their legs resulting from cancer surgery. And then as she said, I assume that an assessment would take place first, but then would you place them on a specific program to help with swelling and recurrence of cancer? Yeah, it's all the same principles, basically. It doesn't really matter where the which limb it is. It's kind of the same approach, same principles. Yeah, it's just not really likely to happen in a breast cancer case, but I mean, every situation is different. But yeah, no, same type of approach, and same have to be assessed completely, and have to, you know, get a lymph scintigraphy done, especially like that helps to just go kind of as thorough as we can with assessments and diagnosis and getting supports in. But yeah, that's why for me, one of my biggest pet peeves I've noticed just in this world is a lot of people have no idea. There's no conversation. It's just yep, you're gonna have surgery, this is gonna happen, you might get lymphedema, period. That's the end of the conversation sometimes. And people are so lost. And there's so much that, I mean, all of the lists of the things we talked about today, they're not absolutes, like in terms of the repetitive motion. It's not that you can't ever do that. It's just you have to be more mindful of, okay, if I'm doing that today, do I notice if there's a bit more swelling? It's not necessarily something that blows up overnight. It can be a very gradual worsening. So good to kind of keep that in mind. Yeah.
Dr. Valero, I had a question for you, and I'm not sure that I followed what you were saying, because I'm 8 years out from my breast cancer, and I have lymphedema on my right side. But you were talking about that blue dye, and I wasn't sure where that fit in. Are you saying that they need to do that when you're having your breast cancer surgery?
Right. So, you know, it kind of when someone's diagnosed and you're sort of in that limbo period where that, you know, they need to look at the lymph nodes, but it hasn't happened. That's when they decide if they're going to do the mapping, or if they're sometimes they just take it out and there's no conversation. Like it can be this is the part that's a whirlwind for a lot of people. And many people don't even know that they've had this done, to be honest. So I just thought I'd bring it up because it's just part of the conversation sometimes. But
so they do the mapping and then they know, what do they gain from that, or what do you gain from that?
So the point where they would typically do it is if you went in for surgery to like have a lumpectomy or a mastectomy,
Right.
and there's concern for the lymph nodes, or they might already be pretty confident that some of them have them, they need to add the dye so that once you add it, the dye will follow the lymphatic trail. And so the dye will eventually kind of stop showing up where there really isn't as much involvement. So it just helps to show, okay, if this lymph node had cancer, where does it travel to? Like, what's it actually feeding? And all the ones that light up that are kind of changed in color are the ones that they'll remove on the spot. It'll help guide them. Okay, we're going to take all these 5 out. And then that's why you'll hear some people say, well, they thought they were going to take, this many, and they only took that many because of this, like the whole mapping process. That's how they decide the whole thing. I've had some patients come to me in the past just really concerned about the dye of just, what if that's toxic? What if that creates cancer? And what if this is like, actually, you just really want to know what we're dealing with. Like, I wouldn't worry about that. We have ways to deal with that, get it out of the system. Like, we don't need to worry about that at all. But
Now, I was just thinking that, oh God, did they miss a step? Like, they just took all my lymph nodes out and told me after.
Yeah,
And,
in that case,
know,
it's like if that was the plan to take it all, then they don't really need to do that because it's just they're just
I
taking
think
it all
they
out.
just took them
Yeah.
once they got in there.
Yeah,
They never said anything to me, and I was actually shocked. I think I had like 49 or something, and I'm not a big person, so I was shocked at how many, or 52, and they took them all, but then they told me about maybe 11 were bad.
right.
Right? But
Yeah.
they took all of them, and like in hindsight, I'm thinking, why didn't they leave me a few? But at the time,
Yeah.
I was glad, like, take anything, take everything.
Exactly. And this is definitely like, I think Susan just added, like, is the dye presented as an option or just standard? Kind of like what you're bringing up is I feel like a lot of patients sometimes they come to me after all this has happened, and it's just such a whirlwind of craziness. So just, okay, I guess I'm having surgery and I'm still choking on the diagnosis. And like, there's just so much to do that half the time it is not presented as an option. They'll never talk to you about that. It's just something I've noticed that some people are really doing the research, like, what are they doing to me? And some patients do have like true informed consent where every detail will be talked about before the surgery, and they'll look into it and they'll realize, oh, this dye, like what is that made of? And that's where that'll come from. But I could tell you, like, pretty much 99% of the time, a patient will have no idea that this is what's going on, that there's a difference between dyes. And at the end of the day, I would say it's not something to really worry too much about. The main reason I brought it up is because I've had quite a few people ask me of like, should I be doing that? Is that okay? And I always kind of say like, yes, like, don't worry at all. And, I've had some people, they're concerned after. I think that's where a lot of the concern stems from, is after the entire breast might turn blue. Like if there was a lumpectomy, the tissue around that it's like a little Smurf kind of effect. And so that will freak someone out. And then you start wondering, like, is that safe? Is this okay? And it is. And we actually have tools that we can do in the clinic to get that out of there even faster, but not enough to be a concern to not do the mapping. Because like we said, the mapping could spare the severity of the lymphedema. And that's sort of where it's the surgeon who will make that kind of clinical decision of, is it worth it to take the chance? Do we just take them all? Because if it's 11, I mean, that's so many. So in taking them all, they were just trying to make sure this doesn't come back. We have to make sure, because that's the thing too about the lymphatics is it's not easy for a cancer cell to break through into the lymphatics. And so if it can get past, it's called a sinus. If it can do that, it survived a hypoxic environment where there's no oxygen. So it has to be pretty aggressive to survive that. And if it does, and then it's allowed to travel, that's why it can metastasize. And that's that's the decision point for them to say, is it worth it? Should we take them all? Or do we just, follow the mapping kind of thing? That's where that's kind of becomes the standard of care that they do.
No, I understand. I mean, it was stage 3 for me, and they told me it was very aggressive. My actual lump was very tiny.
Wow.
But the kind I had was very aggressive. So I would have let them take everything out. There would be no decision, like, take it all, like,
Well, and keep in mind too, that technology is developing and advancing so much that, even in just a few years, you'll see technology coming out now. And I believe it's already being practiced, but I just don't think it's out completely, where they are able now to test the lymph nodes before they remove them. And so now we're hoping that we won't see lymphedema being caused through lymph node dissection, because they're able to test it before they even remove it. So technology is going to get to a point where we don't have to do this dissection unless there's cancer present.
Right, right.
Thank you. I don't see any other questions. Do you, Maddie? I don't. Oh,
No, just a comment. And I'm just writing back, thank you. If I knew how to spell, that'd be lovely, because that does not say Catherine whatsoever. There we go.
Okay. Well, thank you. Thank you very much, Maddie. Thank you very much, Dr. Valero. It was a very interesting webinar. And if I get any questions, I'll, after the fact, we'll certainly share them with you. And as I mentioned earlier, we're hoping to have it posted in a couple of weeks, and we'll let everyone know.
Perfect. And just before we end, Dr. Valero, are you still doing virtual appointments?
Oh yeah. Oh yeah.
So if anyone is interested, Dr. Valero is able to be booked virtual. So if you're not local to us, and as well, which I completely, as we were doing our webinar, I completely forgot that the V Apothecary also carries the lymphology skincare and ships Canada-wide, if I'm correct, or worldwide.
Yeah, you know what? I just realized,
See?
I think
So-
somehow that slide didn't pop up. Oh my God. Where did
Oh,
it
that's
go?
okay. But I just got to
Yeah,
thinking
we have
that,
it there.
you can purchase it there as well. So Angeloni Health and V Apothecary. And then, like I said, if you're interested in having an appointment with Dr. Valero, she does have virtuals. And I didn't know if you were going to mention that, but I wanted to make sure.
Yeah, it was one of the second, I totally missed that slide. I actually did want to say that, like, I really love the cream, because the lotion, because it is important to keep it hydrated, and it doesn't contain like lanolin or fragrances. And a lot of lotions that are out there actually totally do. And it can irritate the skin. It can actually make that really complicated. And so the formula with lymphology is really great, because it really does prevent that irritation, and really is pretty crucial. It's hard to find that in the market. A lot of actually clean products that won't irritate is tough to find. So I'm so disappointed. I had a little slide on all of that. There's a few other points I missed, and I have it on my screen, but I don't think anyone else, I don't know if anyone else can see that, but
okay.
it's, yeah. Oh, that's
Perfect. No, that's okay. That's okay. But I just wanted to make sure that if people wanted to have an appointment with you, that they know that there is an option to do that and book with you online.
Absolutely. Yeah.
All right. Thank you so much for having us.
Yeah. Thank you so
Yes,
much. This was great.
thank you. And, hopefully we'll see you guys again, in the next couple of months.
Absolutely.
Excellent.
Yeah.
Thank you. Thank you all for attending. I know it was a beautiful day outside. It's hard to sit in on Zoom, but this was a very, very informative session. So thank you all again, and have a good evening.
Thank you. Bye, everyone.
Bye-bye. I can just end it, Maddie.
Okay. I don't know what to do with the recording.
No, I'm just going to stop it when I end it now.
Okay, perfect.
Okay, and we'll check that before we post it. Abby will check to make sure, it starts and stops at a good time.